All right, today we're going to dive into a pretty incredible medication called Ticagrelor. This is a big one, a real heavy hitter in the fight against heart attacks and strokes.
But let me start by asking you a question. Think about this. How in the world do you stop a heart attack while it's already happening? It's an absolutely terrifying, high-stakes problem. And the answer lies in going right after the root cause, which is exactly what this drug was made to do.
So to really get a handle on the solution, first we have to understand the problem. And it's a big one. We can call the clotting crisis.
At its heart, the danger is a blood clot forming where it has no business being. You see, when a clot blocks up an artery, it's like a sudden, catastrophic roadblock. It completely cuts off that precious oxygen-rich blood. And if that artery is feeding the heart, that's a heart attack. If it's feeding the brain, that's a stroke.
So what is it that actually triggers these dangerous roadblocks? Well, for that, we need to zoom way in and take a look at what's going on inside our own bloodstream.
Okay, meet the main characters in this story, platelets. Now, these little cell fragments are normally our best friends. When you get a cut, they're the first responders. They rush to the scene, they stick together, and they form a plug to stop the bleeding. It's a totally vital, life-saving job. The problem is, in arteries that are already diseased, this whole process can go haywire. And to understand how it all works, just imagine that every single platelet has a special little lock on its surface. This lock is called the P2Y12 receptor. When the right chemical key comes along and fits perfectly into this lock, it's like flipping a switch. It tells the platelet, okay, time to get sticky, time to start a clot. And this is what kicks off a dangerous chain reaction. A chemical key, known as ADP, gets released into the blood. It finds that P2Y12 receptor, that lock, and clicks into place. And bam! Instantly, the platelet activates. It becomes incredibly sticky and starts sending out signals to all the other platelets to come join the party. And that's how a dangerous clot begins. So, if the whole problem is a key turning a lock, well, the solution is pretty clear, right? You have to block the lock. And this brings us to what makes Ticagrelor so special. Its unique action. Here's the most important thing to know. Ticagrelor, which you might know by its brand name, Brilinta, is engineered to do one thing and do it really well. It physically gets in the way of that P2Y12 receptor. It's kind of like putting a cover over the keyhole so that key can no longer get in and start the whole clotting mess. And this is where it really shines compared to older drugs like Clopidogrel. Ticagrelor works directly and it works fast. But the real game changer here is that its effect is reversible. It blocks the receptor for a while, but then it lets go. Older drugs, on the other hand, bind permanently. They basically shut down that platelet for its entire life. That reversibility is a huge advantage, especially if a patient suddenly needs emergency surgery. Okay, so we've got the science down, but how does all this translate into actually saving lives? Let's take a look at how doctors are putting this drug to work. So its main job is treating something called acute coronary syndrome, or ACS. Now, that's just the broad medical term for any situation where blood flow to the heart gets blocked all of a sudden. We're talking everything from unstable chest pain all the way to a massive heart attack. It's also used longer term to help protect high-risk patients who've already had a heart attack or have a stent. Okay, now you need to listen to this because it is incredibly important. Ticagrelor has what's called a black box warning from the FDA that is their most serious kind. It has to be used with aspirin, but, and this is the key, only low-dose aspirin. If you take more than 100 milligrams a day, it can actually make Ticagrelor work less well. It's a really delicate balancing act. Of course, any drug this powerful is going to have a flip side. It's absolutely essential that we talk about the risks and the red flags. The number one risk, and it's not even close, is bleeding. And honestly, it makes perfect sense, right? If you have a drug that is expertly designed to stop your blood from clotting, well, it's also going to make it harder for your body to stop bleeding when it needs to. This can be anything from just more bruising or a nosebleed to very serious, life-threatening internal bleeding. Ticagrelor also has this kind of weird characteristic side effect, shortness of breath. The medical term is dyspnea. It happens in about, 10 to 20% of patients. Now, I know that sounds alarming, but for most people, the feeling is usually pretty mild, and it tends to go away on its own. Another huge thing you have to worry about is how it interacts with other medications. See, your body breaks down ticagrelor using a specific enzyme in the liver. Some drugs can block that enzyme, which causes the levels of ticagrelor in your blood to skyrocket, creating a massive risk for bleeding. But other drugs do the exact opposite, flushing the drug out of your system way too fast and leaving you completely unprotected from clots.
So, with all of this information, where do we land? Well, it all comes down to carefully weighing the benefit-risk balance. Here is the bottom line. Ticagrelor is a cornerstone of modern cardiology, no question. It is an incredibly powerful, life-saving tool that has completely changed the game for patients having a heart attack. But all that power comes with very real risks that demand constant, careful management from both the doctors and the patients.
You know, a medication this potent is a true double-edged sword. It can prevent a clot that could kill you, but it can also cause a bleed that could kill you. And that leaves us with a really fundamental question. How do we, as a society and as individuals, weigh that incredible reward against that very real risk?